Pleural mesothelioma patients often find it hard to breathe because fluids build up in the lungs. This is called pleural effusion. But the good news, draining it may give you instant relief. Some patients even drain their fluid at home without hospital visit. Today, I'm going to show you 3 drainage options that may help you breathe easier, including one that can permanently stop the fluid from coming back. Hi, I'm Deborah from Surviving Mesothelioma. For nearly 20 years, we've helped over 18,000 patients and their families understand their treatment options and find ways to live more comfortably with mesothelioma. Okay, so what is the pleura? Between your lungs and your chest muscles, there is a thin protective lining called the pleura, and it is made of 2 membranes with some liquid between them. The pleura is there to keep your lungs safe, but pleural mesothelioma can cause something called pleural effusion, and that is when extra fluids start filling in the protective lining. And when it gets too full, it can start working against you. So too much liquid in the pleura can crowd your lungs. And when your lungs don't have enough room to expand, it can cause shortness of breath and difficulty breathing. Thankfully, doctors have different procedures that they can use to drain the fluid around the lungs and help patients breathe easier. So let's look at 3 of them. All right, procedure number 1, thoracentesis. Thoracentesis just means using a needle to drain fluids from the chest. Here's how it works. The doctor inserts a thin needle or catheter through your chest wall, and then they drain the liquid to make more room for your lungs. Many patients get quick results. Once that fluid is drained, they can breathe more comfortably, and the feeling of pressure in the chest may go away. But that relief may be temporary. The cancer can make the lining fill up with fluid again. And when it does, the shortness of breath comes back. That is when the next procedure may come in. Okay, procedure number 2, a PleurX Catheter. If the fluid keeps coming back, your doctor may recommend installing a PleurX Catheter. It is a drain that is inserted surgically into the pleura, and it leaves you with just a thin, flexible tube that sticks out of your chest, and most of the time, the catheter tube will be covered with a large bandage. But when fluid needs to be drained, you can remove the bandage, connect the tube to a special vacuum bottle, and the fluid then slowly drains out of the chest, travels through the tube, and collects inside the bottle. It's similar to thoracentesis, except patients can drain the fluid themselves at home. And that means they can get relief more often without needing a hospital appointment every time. Procedure number 3, Talc Pleurodesis. Okay, pleurodesis is a procedure where doctors seal the 2 layers of the lining around your lungs. They do this because they want to stop any fluid from getting in and building up. Sometimes the pleura will seal naturally, but doctors can also seal it using a surgical procedure called a Talc Pleurodesis. So during the procedure, they place a special sterile talc powder inside the lining around your lungs. The powder causes a mild reaction that makes the 2 layers of the lining stick together. And once they're sealed, the fluid can't come back. And that means no more catheters, no more draining. It's a permanent fix. But it's not guaranteed to work, especially if the lung can't expand fully. If the tumor is too big or has spread too far, the seal may not hold, and in those cases, doctors may recommend against doing the procedure. But draining with a needle or a catheter may still be an option. At the end of the day, there's no single best way to manage pleural effusion or fluid buildup. Every patient is different, and for some, sealing the pleura might be an option. For others, draining fluid with a needle might be better. If you think you may be experiencing symptoms of pleural effusion, your doctor will be able to discuss which treatments may be suitable for you. And if you're worried about the cost of these procedures, we may be able to help you understand your financial options. Even when insurance covers your treatment, the costs can still add up. Knowing what to expect can make a big difference. To find out if we can help, 888-876-5051 to speak with someone who can help walk you through it. And remember, stay informed, stay hopeful, and keep fighting. I'll see you in the next video.